Ed Dean, weekdays 5 to 7 p.m. on FM 99.9, 94.7, and 100.7. The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
This is Joe Steckler, folks, your host for Helping Seniors, the radio arm of Helping Seniors of Brevard County. The purpose of Helping Seniors is to inform, to educate, and to connect seniors and those that care for seniors to resources that will help them simply age with dignity, and in many cases, just help them to live a decent life. We're finding that so many people don't know anything about all the many wonderful programs in Brevard County that are in place to help people. And that's one of our primary missions, is to make people aware of what is available to help them. The phone number to reach Kay Kaiser, our information specialist at her office, is 321-473-7770. I'll say it again, 473-7770, and you're welcome to call WMEL anytime during radio station to ask Carol or me or Kerry a question. This is our second show of 2017. I'm really I want to take just a second to let our listeners know what we're trying to do in 2017. For many years, since I've been getting older, it's time to find somebody to take my place. And so we've settled on Kerry Fink is going to be our executive director. Kerry's with me in the studio today. Kerry is well-versed in communications, the media, the print media, the spoken media, the written, and all of it. So I'm very, very happy that he's with us. And also in the panel with me today is Carol Wheatley. Carol is with threefold chaplaincy, and I'll let Kerry tell you a little bit more about that. But as you listen to the radio show, think in terms of what Carol is doing, what Kerry is doing, what I'm trying to help them do, in terms of building a network, a senior network, a network that will let people that provide services to seniors we'll let people know about them through this radio station, through the television advertising, through our printed media. It's all about information and education and helping people. We charge nothing for our services, and that's one of the reasons we've got to do a good job in being innovative about raising our funding, because the government sources are reduced. They're going to get more reduced with the new presidency. I'm certain of it. I said some things 5 years ago, 8 years ago. It all came true. People wouldn't believe me. But, it's always easier to look in hindsight, Kerry and Carol, but sometimes the predictions we make do come true based on what we think about people, what they're trying to do. So having said all that, I'd just like to introduce Kerry first, and then Carol. Kerry, you're going to be our new executive director. How do you feel about that job?
I'm excited about it. It's a new role for me because it's expanded, but at the same time, I've been privileged to be alongside helping seniors actually since the very beginning, and served more in the role of media and helping along those sides. But one of the things that's really exciting about the opportunity ahead is, we're going into our 6th year. So that's already means we've already have a half decade of service. And of course, you've got decades and decades of service.
Don't talk about that way. That's
but it's really exciting because, particularly in a time when things are shifting, there's more than ever a need to get information out. That's always been a cornerstone of what Helping Seniors has done, both in terms of being a resource for people to call in to the information hotline and get help with their specific circumstances. But then you've always had a passion for making sure the word gets out, both through newspaper articles, magazine articles. You do the radio. You did the radio show for something 16 or 20 years here at WMEL, and with the TV shows we do. And the important thing is to get people up to speed so they don't feel isolated or they don't feel like they can't get help for their situation that they need. And so one of the things that we're going to talk about today is we're privileged to have Carol Wheatley. Carol is in the studio. We're going to talk about a number of topics today, one of which is chaplaincy, and we'll go into that a little bit more, but we're also going to talk about senior advocacy. So it's actually, we have two parts of the program today, but Carol is the CEO of an organization called Power in the Workplace, which is in itself a 501c3, and she has a lifetime of experience in working with different organizations and helping them. But on a personal level, and that's what we're going to talk about first, is about chaplaincy. So welcome, Carol. How are you today?
Thank you very much. I am great. Thank you so much for having me here, Joe. Thank you.
Yeah,
I
you're
appreciate
welcome.
being invited. And it's always a good opportunity to be able to introduce chaplaincy to the community, because it's such a much needed service that just about anybody can get involved in. All they have to do is have a heart to want to serve.
Folks, I asked Carol if her chaplaincy was a ministry type thing or what it was, and possibly when you heard her say the word chaplaincy or heard Kerry say it, right away you thought about an ordained minister. I'm sure that's what you thought, because I did. But Carol, how about explaining what threefold chaplaincy is, what it
More than
does,
glad
and
to.
how it affects seniors especially?
Sure. A chaplain is an individual who, we like to say, practices the ministry of presence. In other words, we just sometimes need to be there. If there's a incident, if there's a shooting, if there's a natural disaster, people are in all different frames of mind depending on how the disaster has impacted them. Excuse me. And sometimes the chaplain just needs to go up and be with that person. There's a huge difference between preaching and being a chaplain. Preachers talk a lot. They're supposed to. They're supposed to impart information. Chaplains do things like come
Listen.
alongside an individual. Exactly, Joe. They listen. They ask questions like, when was the last time you sat down? Do you know where your keys are? Is your family safe? And we try to be available to meet whatever need that individual has. And so from a chaplaincy standpoint, do we pray? Yeah, a lot of times we pray with our mouths shut, because we're there to do whatever it is that individual we're with needs.
You say that because I remember roughly 18 years ago, a couple came into my office on Friday afternoon at 4 o'clock, and they were the same age then as I am now. And they asked if they could talk to me. I said, certainly. And I listened to them for 3 hours, or 2 hours, or 1 hour. I listened to them for 1 hour. At the end of the time, they asked me a question. I said something. And I said something one time during the hour. And the couple sat there in front of my desk holding hands, and what they were concerned about was the fact that he was blind and she was in the first stages of Alzheimer's. Mm-hmm. And they wanted to make sure that they both understood everything they had done, and they agreed that everything had all the proper documents in place and everything. And they asked me a lot of questions. I answered their questions. And as they got up, the woman said, I want to thank you, Mr. Steckler. I said, why? I just listened to you. She said, you're the first person that's listened. She said, everybody else is always trying to tell us what we have to do, what we should do, what we need to do. She said, you listen to us. She said, you can corroborate what we thought we had done was correct. I said, as best I can tell, what you two have done, if you put together a plan for when one of you can no longer recognize what's happening. And she said, that's exactly what we wanted to do. She said, we wanted to make sure that we understood each other. And, you know, that made me think so many times that what you're talking about, chaplaincy, if we don't practice the art of listening, we never really find out what's in somebody else's heart.
I think you're 100% right in that. And one of the things that we stress in the threefold volunteer chaplaincy program is the art of listening. A lot of people simply haven't been taught how to communicate properly, and especially in an unfamiliar situation when you have a volunteer who willingly goes to another individual's home and they're surrounded by new things, new sounds, new commotions going on. But if they've been trained in how to focus and how to listen and how to discern what the individual is truly saying, not just what they're saying on the surface, Joe. But really, this woman who was in your office really sort of said to you, nobody respects us. We're in somewhat of a fearful state, not knowing what the future brings. And so what you did was allay their fears. And that's really what chaplaincy does as well. We listen, we see where there's a need, we try to meet the need, whether it's right then and there or whether it's by obtaining resources, because it's critical for people who feel powerless to understand that they are not without power. They just have to get someone to listen. And that's why I think, personally, it's so important to have volunteers in our community be specifically trained to go into the confined care community and minister to them on whatever level they need it.
Kerry, you mentioned something before the show. Why don't you take over and talk to Carol? You two have a dialogue about what you told me what happened with the recent in our area.
You know, we were talking about people often are familiar with maybe a chaplain drops by if you're in a hospital room or something like that. Or maybe they understand a chaplain from a military context. So question is, where does it happen in real life occurrences that happen day in, day out? So we were just talking before the show that when this terrible tragedy happened over in Orlando with the shooting there in the nightclub, that Carol was one of the people that was called in by the Franklin Graham organization to come and minister to those people. Because you think about it, not only are the people that went through this in a state of shock after a situation like that, but even the first responders and people like that are also, they're having to be helped, but then they need help after they've helped. So there's this whole multiple layer. And one of the questions that Carol had sent, which I thought was a great question for me to ask you, is why do communities need chaplains? And hopefully that was part of the answer.
That's exactly part of the answer, because of the fact that people hurt. And in today's society, we don't always acknowledge that. Suck it up, you'll be okay. No, you can't do that to people, especially when there's a horrific occurrence like we had at the polls in Orlando. And so what happens is when you get chaplains in there, you get an opportunity to minister to the people who are still in shock, because you're not preaching to them. You're not condemning them like a lot of things that we see in society today. People are condemned for their actions, condemned for their beliefs. A chaplain goes in and just simply, can I put my arm around you? Did you have a glass of water? Kind of like we would do every time. Yeah. And when I was ministering to the families of the nightclub victims, those who had not yet received death notifications, the grief on their behalf was overwhelming. The people themselves, the family members who had lost loved ones but didn't know it officially yet, it was chaotic in their grief and in their trying to put one foot in front of the other. And for someone just to stand there with them and pray quietly, and a lot of people will during a time like that ask for prayer. And so we have to know what prayers to pray. You can't just spout off whatever you think, Yeah,
I was going to say, I heard a pastor once, our pastor actually, he said, he was looking at a news story on TV. It was a tragedy in some land far away, and he said, I can't speak their language, but I can feel their pain. I can't even hear what they're saying, but I feel their pain. There was a picture. I'll find it and I'll get it for our Facebook page. But they actually had a picture of you kneeling and praying with a person from that actually ended up being on the front cover of, as Franklin Graham was reporting about what they did there. And the picture is one of those pictures that speaks volumes, because you can just see, you're there to do whatever you can for a person who's going through what, we can't even relate to in terms of grief.
Exactly. One of the things that I have is training through the International Fellowship of Chaplains, but I'm also certified through the ICISF in individual and group crisis intervention. So in order to serve with Billy Graham, you have to go through these things. But the threefold chaplaincy volunteer training is for people who just want to serve in a community level and be a visitor, but they want to be better prepared for it.
Okay, somebody. Let's go ahead and talk about it. How does somebody get involved? Say somebody, they really are listening to us and they get a sort of a glimmer that maybe I want to know more about it.
Right.
What do they do? How do they find out more about it? And once they find out, what do they find out from you that may want to cause them to go into your training program? And if they go into the program, is there a charge for the program, or what do you train these people to do? And then how does the whole thing work?
How does that happen?
That's a loaded question.
Yeah, I get it. They can find out more information at powerintheworkplace.com. That's our website. It has a link to the threefold chaplaincy training program, and there's all the information in there. The program is free. It's a 2-part program. You have to go through both parts. It's a Saturday afternoon, 2 consecutive Saturday afternoons. Actually, the next program that we're doing is going to be at Christian Care Ministry on O'Galley Boulevard in Melbourne, and it's going to be February the 25th and the following Saturday, which is March 4th. So again, you have to register online in order to be able to attend the program, because seating is limited, collateral materials are limited. But we love to have you. But what we do is we teach you the fundamentals of chaplaincy. And we teach you the fundamentals of volunteerism, because there's so many really good organizations in Brevard County, and they have wonderful volunteers, and then they've got some not so wonderful volunteers. And so what we do is we address that. What does it really take to be a good volunteer with this organization or with whatever organization you're at? We also go into individual churches and nonprofits and teach people how to get their staff and their volunteers to cooperate, and what the business owners, business directors have to do to make that happen. Because when volunteers come in, it's not going to be a benefit to anybody if those volunteers are not properly trained.
Exactly right.
You know, and
that's the worst thing in the world, is to have another person underfoot that doesn't know what's going on, and you got to worry about them.
Exactly. And the things that we cover is the role of a threefold chaplaincy volunteer. Now, when they come out of this program, they are not a certified chaplain. They are a chaplaincy volunteer. And we make that very specific because the word chaplain brings with it certain implications of competency and training.
Right, it does.
So we're very careful about letting people understand. But we're also careful about letting them know that you really need this training if you're going to be a volunteer in your community. And so we explain the roles, we explain the importance of being trained, the importance of working properly, the importance of, from a Christian perspective, the importance of knowing what scriptures to use. And we teach them things. What do you say when you go into a room and the doctor has just given the person in the bed a death sentence? What do you say to that person, you know? And we go through some of these scenarios with them so that they're prepared. We teach them what to say, and more importantly, Joe, we teach them what not to say.
Do you ever work with hospice volunteers?
Yes, I do.
That's interesting, because I thought about that when you made that comment about talking to somebody about a death sentence.
Yeah.
Kerry, you have another reason, ulterior motive, for wanting Carol to help you. Well, I'm going to talk about that.
Well, first of all, Carol has a lifetime of experience in working with not-for-profits and helping us along. And I know one of the directions that we're going to talk about later in the show is what we want to do with Senior Advocacy. And one of the things that you guys were just touching on is the fact that we know how many volunteers there are who want to get involved and be helping seniors. And I think we'll maximize maximize our effectiveness at that if we get everybody, like I said, all on the same page. And there's probably a lot of things we can learn from Carol in areas like that. And so we've been blessed that she's volunteered to help us along with that. And, you know, it's interesting as we're having this conversation about chaplaincy, the three of us in this room, we're all professing Christians, but I have a question. In today's world, sometimes people get that confused that says a chaplain is like a preacher, and yet when you go out and you're on the chaplaincy front, you could be talking to somebody that either is of a different faith or has no faith whatsoever. They don't know what they believe in, right, or if they believe in anything. How do you as a chaplain, or what do you teach people in your course, or what's your basic approach with today's many religions in the world?
Well, it's not as hard as you would think, because of the fact that in addition to being an ordained chaplain, I'm also an ordained minister, so I place a lot of emphasis on Scripture. However, I also teach the volunteers how to go in and minister to people who are not of their own faith. If an individual is Muslim or Hindu, it doesn't matter to a chaplain. The chaplain is there filled with a heart of compassion to empathize and support and encourage the individual they're with. It doesn't matter what their faith is. What matters is, what's your faith? What's in your heart?
Do you train volunteers to be in your chaplaincy program to work in the hospitals too?
Absolutely, yes. The program that we have developed and that we train to it will really prepare an individual to work in almost any realm.
That's interesting. Do you ever work with Father Brooker down at Holmes?
Father Bob.
You know,
yes,
Father Bob?
Of course.
You know,
he's an amazing individual.
Yeah.
He has done so much for this community. I just give you props, Father Bob.
Well, see, this is really one of the things when we talk about hidden assets and unknown resources in Brevard County. Father Bob was very close to Father Bill Lewis, I happen to be Catholic. Father Lewis is Episcopalian, and he was on my radio show when I first started out. I have all the respect in the world for that man. And Father Bob Brooker was very close to him, and Father Bob was very close to Charlotte Millspaugh, who followed me as a director at the Alzheimer's program. But it all comes back to roots. We're just about, I'll finish out the half hour here. It all comes back, folks, that we're all connected in many ways. We don't understand the many ways we're connected to each other until we start a dialogue of conversation. Once the dialogue of conversation starts, all new areas open up, ways you can help people, ways people can be helped, needs that people have. So with that thought in mind, we're going to talk about advocacy on the second part of the program. Carol, take the lead on it. Stay with us.
It's the Talk to Me Network on AM 1510, FM 99.9, 94.7, and 100.7.
This is Joe Steckler, folks. We're back live with the second half of Helping Seniors. Remember, our mission is to educate, inform, and connect seniors and those that care for seniors to resources. Kay Kaiser is our information specialist. You can reach Kay at area code 321-473-7770. I forgot to mention some of our sponsors. I'd like to mention a few of them this time so you could see the range of services that people help get the information out to you. The Eye Institute, Dr. Lee Sheldon, Bill Johnson, elder law attorney, Zon Beachside, Riverview Estates, Ebony News Today, Brevard Chiropractic, Senior Scene Magazine, Hometown News, Spotlight Magazine, Fountains of Melbourne, Seniors Helping Seniors. It's a tremendous way to help people, help family members at a very, very low cost. Certainly much cheaper than putting them in an assisted living or nursing home before they need to be there. So Vitas Hospice is one of our sponsors. They're very, very good. Ear Care, Canadian Meds, Aldea Today, and Home Personal Services Care. There's just so many, folks. I could go on and on and on. And we hope in the next 6 months to quadruple that number of sponsors I just got through reading off to you, because the people that can provide good, quality, effective services to you are the ones you need to know about. Because generally speaking, those are the ones that are going to do it in a manner such that you can afford it. care is a very complicated thing. Care can be spread out over a lot of family members if you know how to work the family members properly. There's just so many things you can do, and that's what helping seniors does. I remember a real quick story. One time when I was executive director of the Alzheimer's Foundation, we had a family, a mother and father, wanted to remain together in assisted living care. They had 5 children. The 5 children were just at odds ends about how they were going to help their mother and father. And they said, well, their mother and dad didn't have enough money to go into an assisted living facility. And I listened to those people bicker and bicker and bicker. And I finally went in over and I interrupted them in our conference room. And I said, I've been listening to you all talk all this time. I said, 4 of you are doctors. I said, I can't imagine you sitting here saying this to your brothers and sisters that you're saying. Why don't each of you agree to contribute so much each month to your mother and dad's care, supplement what they have, put them in a place where they're happy, then you won't have to fight among each other to figure out who's going to bear the biggest burden of the share of cost of care. Do you know, they stopped and they looked at me and they apologized. And they worked it out very quickly. The solution was effective. The mother and father were very happy. The kids were happy too because they were able to do something to help their mom and dad in a way that they wanted to be helped. They wanted to stay together, didn't want to be split up. And we see this so many times, Kerry and Carol, that families are broken apart because they simply don't understand what's available. Chaplaincy is something that could help understand that. But how about, Kerry, you take over now. Let's talk about advocacy. And then I want the people to understand where you think you're going as executive director with the advocacy program and how Carol can be a help to you in that.
No, absolutely. Well, the first thing is, I beat this drum a lot that we live in Brevard County, which likes to characterize ourselves as elder-friendly. And there's a question: what does that actually mean? Yeah. Well, we live in a county that 1 in 2 people meet the definition, as ARP calls it. If you're 50, you're a senior, and 1 in 4 people are age 65 plus. So I think you quoted the statistic. It was something like we're the 24th oldest county in America by percentage of population.
Out of 3,067 counties in the United States, we're the 24th oldest, yes.
So we really should strive to be elder-friendly once we define what that means. And so we can talk about things that are good and we can talk about things that need to be improved on so many levels. But one of the things that happens is if we're not out there gently pounding our fist on the table saying, what about the seniors, then it is a squeaky wheel that's going to get some grease at the end of the day. Well, I know we've had conversations before that when you break apart the county budget and you try to isolate items that are just really, and services that are really designated for seniors, I think we came to the conclusion it was like 1/10 of 1% of $1 billion budget.
Yes.
And when you think about that, who actually pays the taxes in the community? Who actually is here that has paid their taxes their entire lifetime?
Seniors are the second largest contributing sector to that budget. And the county budget manager's office cannot even tell you how much money the seniors contribute. They do not know because I asked them and they told me they don't know. Right. They work it on percentages.
Well, it's not only that, Joe. Think about this aspect. Because we have such a high concentration of seniors, and one of the reasons we exist is because we were advocating just a moment ago for our own sponsors who help keep the lights on for helping seniors. And without them, we couldn't do what we do.
Exactly right.
But those businesses also, they generate their living by serving seniors in our community. So if you're on a government level, you need to consider that not only are the seniors supporting the government, because that is who is the taxpayer, but even the businesses in the community are serving those seniors. And so there's actually a multiplicative effect. But the question is, who is out there really telling the story on behalf of seniors? And the answer is, for one, you have been all along. You did it first with your career in the Navy, then you moved to Florida, and you do it by getting a good Alzheimer's program foundation set up here. Then you do it again with the Helping Seniors group. And what we're trying to do together now is to get more people into this, because we've talked about this. How is it that we actually just added a half-cent sales tax, right, for kids in school.
For children, yes.
And that's very important. I'm not against kids. I mean, we have kids. We were all kids once. But what about when you get to be a senior? Who's looking after you at that point? A lot of times the senior, as you know, Kay takes these calls every day. In fact, we were talking on the way to the radio show. She was helping a person who had just lost her husband, didn't know how to turn. It was actually probably a good chaplaincy call. I would argue Kay spends half of her day being a chaplain to people on the phone, just helping them get through things. But my point is, who is helping seniors? Who is actually carrying the story, making sure that a 20-something, a 30-something, a 40-something who's working in the government and making decisions about how things are to be, services are to be delivered to citizens, that at least the needs of citizens, that seniors are being represented in that. And that's what the advocacy program is all about. And so we're going to actually, we've been doing this, as you know, for a couple of years. It begins, we do a survey. We started the survey program, I think, actually about 2 years ago, and with help of people like Senior Scene Magazine and a number of others that have helped us get those surveys out, we first asked seniors, what is it you think you need that you're not getting? And we learned some interesting things along the way, didn't we?
We did. We learned that 17% of the people believe that finances are equal to provision of information. 17% thought information, 17% thought finances. But let me tell you something before I forget this, because I want to throw the scare factor in right now. Because I just read a report submitted to the National Association of Elder Law Attorneys, and this was a report from the Kaiser Foundation, who's one of the best at determining what needs for seniors are. They have pretty well documented the fact that the National Meals on Wheels program is going to face a reduction in services. This is not me. This is not Joe Steckler. This is an article from the Kaiser Foundation saying that the director of the National Meals on Wheels program is facing a cutback in their services because government's funding is being reduced. There is a greater need. They don't have the volunteers they need to serve the meals, and the cost of preparing meals, it's all a big ball of wax, who means one thing. We're going to reduce the Meals on Wheels program to seniors. Now, that's not going to happen everywhere. Some places are already scrambling to find local funds to help offset the cost of government programs. It has always bothered me, Kerry and Carol. I remember many years ago that here in Brevard County we had a program run by one nonprofit. It said it was counseling for families in crisis. That wasn't the name of it. That's one of the things they did. And I said to the guy, what would happen if you don't get the funding? And in fact, they did not get the funding for that part of the program. He said, I simply won't do the program, Joe. Well, what the heck? You have people, this was one of the most needy and necessary programs in Brevard County, and they didn't get funded, so they didn't do the program. I think that we need to do a better job, and that's one of the reasons that we need advocates for seniors, because I have never advocated handing a senior everything for free. I don't believe that. I believe that you need to have free services available if they're needed, and you need to have a way to feed a person if they can't feed themselves, and you need a way to provide medicine for them if they can't afford the medicine. Some people simply cannot do some of these things. And what are we going to do? Throw them out like a dog? You can't. You got to help them. And it's not fair for the hospitals to bear the brunt of the cost. We can do better.
There's no question about that. And I think a lot of times, the question is who is carrying that story to the people so that they understand. There are a lot of people who, and there's for two reasons. Number one, the people who are making decisions about service need to really understand. I don't think anybody really moves with a bad intention, but if they're not made aware of what specific needs are. I mean, I'll get a story that just came to mind when you were talking about the Meals on Wheels program. Kay related a story just to me yesterday. She goes, I couldn't believe I was talking to a caller, helping seniors caller who was literally existing on bologna sandwiches, didn't even know that there was a Meals on Wheels program. So as simple as one phone call, put her in contact with a resource. And that's what Helping Seniors does. We try to be on so many levels. Number one, directly for the seniors calling in when they need help. Number two, getting information to seniors that we may never have a chance to meet. And that we do through all the media, the television, the radio, the print, the online resources, the Facebooks, all those things are there for them. But the third aspect, and that's what we're really talking about now, is senior advocacy that Carol and I, we just attended, and Jackie Esterline is also part of the Commission on Aging, and it's very interesting to work through the organizations that the county has set up. That's one place it begins, but the more effectively we can take the story. Our group last year, we began the work on giving the commissioners an idea towards how to develop a countywide aging plan. You would think in a county where we have 1 in 2 people over 50 that we might have a countywide aging plan. And where did our group go to start looking for resources? We started looking at places like Charlotte, North Carolina, who doesn't have nearly the percentage of people, but they do have an aging plan in place. So those are the kind of things that our group, our Helping Seniors advocates and volunteers are participating in.
Yeah. We're trying to do something that just hasn't been done. Years ago, the county commissioners appointed Commissioner Jackie Colon at the time, Peggy Basaka, who was the county manager, and me to come up with a plan for aging. And I met with them. And the first thing they had to say was, well, we can't, it won't do any good to do this because we can't fund it. I said, no. I said, if you don't develop a plan, nobody will know how much it's even going to cost to meet what you don't know you need to meet. I said, you need to have a plan. Then you figure out how you're going to fund it.
Absolutely. I mean, if you think about it, somebody said, well, I need a new roof on my house. So I can't afford it, so I'm not going to have a new roof on my house. You have to flip that logic, and that's what we want to do as advocacy, as we advocate for seniors, is get people to understand. I think sometimes, and you could really speak to this, and Carol, you too, in the chaplaincy role, but I think people are either, if a lot of older people are afraid, and I think a lot of younger people are afraid of getting older. Would you agree with that?
I agree 100%. People don't want to grow older. I don't want to get older, but I am. Right. I am there. I don't like birthdays anymore. I try to ignore them, but I can't do it. And I just simply have too many good things happen to me on my birthdays, like strokes and all these kind of things.
Oh, Lord.
But thank the good Lord, I've been able to come back from that stuff.
Yes.
I frankly enjoy what I do. I enjoy trying to tell a story, and I've written my first article for the Space Coast Space Coast newspaper, the online newspaper, and it is about the reduced Meals on Wheels programs, and it's 388 words. They said 500 words. I maybe fudge a little bit, have just a few words this time, but the point is, Kerry and Carol, that if we don't identify the needs and then figure out a way to meet those needs, we're never going to solve the problem.
Right.
Lance Jarvis, who is the head of the SHINE program, serving the health insurance needs of elders in Brevard County, Lance was the chairman of a United Way study in 1996 that surveyed the needs. They came up with 17 of the most common needs in Brevard County. I've got the paper in a box on my desk at home. And the same elder needs identified in 1996 exist today. Nothing has been done about mitigating or lessening the impact of those needs on the senior community. We've done nothing. We haven't even kept abreast of what we need to do. So that's a big problem. So how are you going to try? What are you trying to get Carol to do?
Well, let's start with everybody. If you have a pencil and paper handy, let me give you a date that we'd like for you to write down. It is Thursday, and it's February the 16th. And what we're going to do is have our first Advocacy Council meeting of 2017. And if you'll call the information line at area code 321-473-7770. It's 321-473-7770, or you can go to our website, helpingseniorsofbrevard.org. you will find information about the location and what all's involved. But we invite you to get involved in the advocacy group. It's easy for me to say. But we really want to invite you, and Joe, I want to invite you to bring that box with the 17 points. We'll bring the information that we learned from our past surveys. Our first order of business is going to be, we're going to be creating a new survey. And we've already talked, for example, John Frederickson is going to help us again to get that out. I know you've got some ideas of how we're going to get that out to members. I know your church has participated in the past in helping us complete these surveys. We're
going to do a better job of working through the churches in 2017. We failed there, Kerry. I just admit it. I'm a commissioned minister to the elder. I was commissioned by Bishop Norbert Dorsey in I think in 1997 or something like that. But it was a 3-year program, and I don't intend to let that training go to waste. It was we met every weekend for training for 3 years. That was an intensive program. That's a 3-year-long program to go through as a volunteer.
Right.
And but we learned a lot, and I've tried to put that into practice, what I've learned through that program, but I realize that there are more people that need to know more about what they don't know about. And
Right, and one of the things that I was going to ask Carol about is we were just talking during the break about the importance of, even if you don't necessarily understand the word chaplaincy or how it may apply to your life, if you have an interest in helping us, in helping seniors, then one of the things you're going to want to do right off the bat is get involved in Carol's training class. Again, we talked about it. It's absolutely free. There's no charge. It is a service that Carol's organization provides. And talk a little bit about that and how you see that helping us as we develop the advocacy world.
Well, one of the things I wanted to mention was the fact that we're ecstatic because of this alliance between the threefold chaplaincy program and helping seniors, because what we find when we send volunteers out into the community, or when we talk to volunteers who may be not part of our program but other programs, the one thing that they keep saying is nobody really knows where to turn for help. So I think out of all the people in this room, I'm probably the most excited because of the fact that I know that we're going to have an opportunity to develop this advocacy group to be able to be that one-stop shop. Because right now, let me just go back for a few years. There was an older couple that I used to go visit every single day. And they had multiple issues that they didn't have any idea where to turn. Nobody helped them. They had people coming in to take their blood pressure, but that was it. They didn't know where to get a hot meal. They didn't know any of the things that they need to know that they could simply find if they knew about Helping Seniors Network and the advocacy that you're doing. And so I'm very excited about doing that. Again, being an advocate for the elder community is critical, but even more critical is being trained as an advocate to the elder community. And so I would just encourage you to call the senior helpline or to call WMEL to get more information about the threefold chaplaincy volunteer training, especially if you plan on volunteering anywhere, doing anything. Basically, it's for volunteers.
People who are seniors, they have a lifetime of experience. I mean, who knows better than a senior? And there's so many of them who say, well, I've been able to work through my life, and now I've got time. I want to do something to give back or pay it forward or whatever you want to call it. And that's a wonderful reason to get involved in helping us with helping seniors. And then, as you know, if you're a senior that needs the help and has been helped, and we've helped, we were talking about it again today, 1,700 plus cases already in the history, and expecting to hopefully go at that rate and then some for many years. And we got to have help for people. So the first step is joining us in that journey and becoming trained as a volunteer, but also making a plan to join us for our advocacy meeting coming up on February 16th, and really taking the time to help us get the word out that seniors need help but can be helped. I mean, that's really the point.
Yeah, I would emphasize the fact that, folks, you'll hear somebody talk about calling a phone number to volunteer for something. This time, I want you to make consideration very carefully. If you think you want to be involved, call the number 473-7770 and tell Kay that you want to be there, because what we don't want to do is have a huge number of people not be able to see them. Bless us that should happen, but it could happen. So, if you're going to put a meeting on, you'd like to be able to take care of the people, volunteers. So, please, if you think you want to come, call us. One phone call and one session at a meeting is not going to hurt anybody. But you might find a way to help somebody else too.
And that's the thing, as we talked about I think on the last radio show too, is that people often assume like there's this wealth of government funding that helps nonprofits do the work. And actually, it usually comes down to a handful of committed volunteers and people who really carry the passion, just like you have for all these years, and just like we're all doing. In fact, it's a joke, but it's not a joke. We keep saying, Joe, you're going to write the book on seniors.
Oh, boy.
Do it, Joe.
You got to help the generations that are coming up, because you're setting the pattern for the rest of us to follow because of the lifetime of experience that you've got in helping seniors.
Well, it's important, and we're just about to. Carol, we got about 40 seconds. You might want to. I'll let you close out the show today. What would you like to tell our listeners? You're a volunteer yourself.
I would like to tell the listeners that without volunteers, this country would come to a grinding halt. The citizens of Brevard County, who are in that 50% of the population, need you. Our community needs people who get out because they care to get out. So I would suggest go to helpingseniorsofbrevard.org and join.
Okay. Thank you, Carol. Thank you, Kerry. I'll see you all next week. Remember that phone number, 473-7770. Call Kay.